So hello and good morning everyone again, and it seems that we're ready to start the panel. And my name is Taner Kuru and I'm a PhD researcher at Tilburg Institute for Law, Technology and Society, as you might also know it as TILT. And I have the honor to organize this panel this year together with Dr. Kiefaber, who's also an associate professor at TILT. And we would like to welcome you all to this panel, which we will be talking about the existing digital divide in Europe and its implications for achieving equal and inclusive healthcare. As we all know, digital emerging health technologies promise to make and transform healthcare to make it more accessible and equal for everyone. But in practice, as some of our participants will delve into in a bit, that some of the things might significantly actually prevent this goal to be achieved, such as lack of representative data sets or digital literacy skills. So today, therefore, we will have a panel to address these issues and see whether and how we can address these issues through legislation or what can we do about them. And while doing so, we wanted actually to prevent this panel to be yet another legal panel in which just lawyers talk about legislation at CPDP, and therefore we have like our stellar set of lineup. They're so much involved in practice, and they will bring all the insights from actually the practice, what like people in practice need from law and legislation. And that being said, I would like to start introducing our panelists. And without taking any further time from you, we have here today present Ms. Nisha Shah. She is a researcher at Helix Institute at Oxford University, and Ove Langfeld, and he's a legal and policy officer at DG Sante. And joining us online, we have Professor Anna Odone from University of Pavia, and also representing the European Public Health Association. And last but not least, we have Dr. Brian Lee Hang Wong from Maastricht University, and also presenting WHO European Observatory on Health Systems and Policy. They're joining us online, as you can see there. And welcome, and you can. I hope that you can both hear and see us as well. So without going into the speeches, let me give you a very brief introduction about the format. So we will have firstly the round of, let's say, introductory sessions that each of our panelists will give you brief insights about their research and their area of expertise. And then we will have the second round in which they will mostly address to each other's comments. And then afterwards, we will have the session for you, the Q&A. And with that, maybe we can start right away with our first speaker. And then I would like to open the discussion by shooting the first question to you, Nisha. And I would like to ask you, as part of your research, you're engaged with various stakeholders around the world and in and outside of Europe, like you're like involved in Europe, and also I know that you recently came back from Japan, for instance. So what are the main reasons for existing inequalities in access to digitalized healthcare in and outside of Europe? Based on your observations. Could you please enlighten us on that?
Thank you so much. That's great. Can you hear me? Thank you so much for that question. I think what I want to do is firstly really give sort of a broad brush to this issue. So the first thing that I'd like to say is that digital technologies or data-driven technologies impact everyone. So the issue that we have is that most people don't really have a say in how digital technologies are to be used and how they shape our society. Especially around healthcare provision, we don't really have those discussions as intensely as we really should. And this kind of goes across the board. And in the UK, we're certainly starting to have a lot more of these deliberative discussions with members of the public, patients, people that where AI, for instance, is going to impact their work. But especially with Japan, with the work that we've been doing with them, they're only starting to get into this paradigm of working in a sort of engagement and involvement fashion with various stakeholders within the digital space. So really what we're discussing today is that there seems to be like a huge crossover between those that are digitally excluded in society and those that are at risk of having poorer health outcomes. So what we found in our research is that when we have conversations with patients and citizens, is that there doesn't seem to be a massive difference in attitude in the use of technologies between different groups, but it's more about how people experience these technologies and the impact that they have on these various different groups that seems to be really important. Especially within the UK context, we live in a very multicultural society, as opposed to, for instance, the Japanese society, which is not as diverse. We tend to have much more acute issues, or people from vulnerable backgrounds tend to experience inequalities much more acutely than other groups. So certainly it depends on circumstances in terms of how digital technologies are impacting various different groups. So on the issue of access to health services via digital means, this becomes problematic when we try and push for a digital first or digital sort of priority situation, and you remove all other avenues when it comes to access to healthcare. And this is a big problem because in the UK alone, something like 15%, it's estimated about 15% of the population lack the basic digital skills to be able to access any form of digital services. So we're leaving a lot of these groups behind because we're not really bringing them with us in the conversations and the decisions that we make around digital technologies. So it's really important that we level up these groups, especially those that are in most need of support. And we can, when we do that, we sort of plug them back into the social and the healthcare support pathways to sort of help them improve their prospects. So we recognise that this is an issue, and we do need to do more to empower vulnerable groups to be able to live in a increasingly digitised society. But the issue that we really raise in our research is how we incentivise and encourage those entities that are making the decisions in digitising healthcare to actually make provisions and ensure that those that are vulnerable don't fall further behind, and we close that digital gap. So actually, in my opinion, through the research that we have done, what I've found is that I think we've had many missed opportunities by not having large-scale deliberations and discussions with those that are going to be impacted by digital technologies, but also we don't have these discussions in the wider context either. So what we do know about digital technologies in healthcare is that they can be sources for good, they can help to improve healthcare and patient outcomes. But there's also a lot to be desired still, because they can be a cause for concern, especially if they negatively impact those that that are usually marginalised in society. So there is also this issue around digital technologies, and accessing healthcare services. When we talk about why we use them, what purposes, and who is sort of making these decisions on why they should be used for healthcare. So we actually need to raise the question of how we define the risks and benefits, and also what is fair for all stakeholders. And fairness is actually something quite difficult to define between different groups and for different purposes. So in general, why are there inequalities in accessing healthcare when it comes to digital technologies? Well, typically there are three aspects that we look at for successful digital inclusion. Firstly is affordability of digital technologies, so whether people can afford to buy devices and get onto platforms. And secondly, it's also an issue of access to the digital infrastructures such as the internet and broadband. And we find that actually a lot of people, vulnerable people, those that are in low socioeconomic classes or those in rural areas certainly, and those that don't have any permanent location tend to have a lack of sort of resources in that aspect. And thirdly, we also have this issue of digital skills, and we know that digital skills also, within healthcare, also overlap with health literacy as well. But digital skills, if we're not going to sort of support people to improve these, then that is an issue. People need these things to be able to solve problems. They need to be able to understand how to navigate the digital spaces to be able to use services. Another thing that we'd add from our research is that whilst these three key things are important for digital inclusion, it's also about the use of technologies aligning with the social and ethical values of the stakeholders that will be impacted. So generally, how do these inequalities seep into the digital health space? We find that it's evident that when vulnerable people can't access these technologies, that sort of certainly sort of reduces their sort of abilities to, live a full life. But we also find that whilst we need to improve the skills, there are also psychosocial factors that are at play here. So certainly vulnerable groups might have, lack of confidence in general and lack of confidence in using these technologies. They may perceive a lack of social support. So how do we actually bridge these issues? So this then becomes a question of not only investing in improving digital skills, but also empowering people to be able to not only use the technologies, but actually be able to raise their voices and their concerns about them. So within our own AID project, we focused mainly on artificial intelligence technologies and healthcare. And we did a round of engagement and involvement work with citizens and patients last year. We did loads of focus groups, we did interviews, and we tried to guide them through various different uses of AI applications in healthcare, mostly machine learning and image-based applications. And the deliberation that we had, what we found was participants generally highlighted their concerns around the uses of their data for purposes that don't align with their values. There was also a point around the lack of choice in the use of technologies to access these services. And also there was no sort of proper discussion about how these technologies will impact them and society much more widely. There were also issues around what the fair trade-offs were in the healthcare context, where issues such as privacy and healthcare outcomes were often weighed upon. So what we see from this is that digital-only contexts and poorly designed systems that don't really consider the social context act as barriers to digital inclusion. So we see that people already suffer from inequalities in other domains, and they will be further disadvantaged when we don't consider their issues when we're implementing technologies in healthcare. So there are lots of examples of where digital technologies have not worked for vulnerable groups, and I'd certainly refer to the issue that we had during the pandemic of people using oximeters and they not working appropriately for people with darker skin. Even before the pandemic, we've had issues highlighted in the general practice context. We've seen a proliferation of digital technologies in this area, but there have also been trials where they've implemented online-only consultation systems. Now, this has created unintended consequences, namely that for some patients who either didn't want to or couldn't use digital technologies, these sorts of systems restricted patients' access to care, and certainly those that were digitally excluded, it made it difficult for them to communicate effectively with their GP. So we see a lot of these examples, and what are we actually doing about this as sort of researchers, but also the decision makers that are bringing these technologies into healthcare? So firstly, as I mentioned before, we need to have these large-scale deliberations. We need to really understand what the impact is of these technologies, who's benefiting from the technologies, and how we sort of build a regulation around them as well. And that's something that certainly the people that we've been speaking to in the research are very much focused on, is the need for that regulation. And the final point that I do want to make is that through our aid work, we've been pointing out that engagement and involvement are mechanisms that enable transparency. And transparency is foundational to trust, and if corporations and organizations want to improve the uptake of their digital technologies, they need to win over the trust from stakeholders, because they're the ones that are going to be mostly impacted. So that's really the final point that I wanted to make, and I'm very happy to take questions afterwards.
Yeah. Okay, thank you very much for setting the stage with this insightful speech, and actually touching upon many of the aspects that we would like to address, such as diversity and vulnerable groups, and affordability, access to digital infrastructure, and especially the lack of digital literacy skills, which actually, especially in the UK context, reminded me the movie Daniel Blake by Ken Loach, so just a reference. So with this, I would like to actually go to one of our online speakers, to Professor O'Donnell. And I would like to ask, you also have first-hand experience from practice regarding the issues that we just addressed today. And besides, as the president of Digital Health section of the European Public Health Association, you have the chance to engage with European public health institutions and the other associations. So based on your observations, how do you think the existing digital divide should be addressed to achieve our goals that we mentioned today? What do you think about this issue?
Yes, so thank you very much. Let me thank you for organizing this panel. As you said, I'm representing the European Public Health Association in its Digital Health section. And this week is the European Public Health Week, so even more so, together with Brian, who's part of the steering committee of the section, we are happy to be here and join this discussion around the digital divide. As it has been very nicely outlined by the previous speaker, when we are talking about the digital divide, is theoretical, but very correct to divide the two levels: access to digital infrastructures, but also on a second level, capabilities to make use of digital tools and instruments, talking about what has been referred to in the literature, digital health literacy. From our perspective, which is the perspective of UFA, which I think it is important to recall, is an umbrella association that brings together national public health associations across the wider European region. We have activities related to research into the digital health in general, and more specifically the digital divide, on advocacy and policy, trying to represent what are the public health goals at the European political levels and institutions. And then we have a third component, which is related to, let's say, public health practice, bringing together public health practitioners in different member states to see how successful interventions and best practices can be adapted or scaled up in different contexts or at the European level. With specific reference to the digital divide, what we observe is that there is wide, and also the data made available by Eurostat and other European level statistics tell us that there is wide heterogeneity across countries. But what I would like to stress from our, let's say, real life perspective is that this heterogeneity is really much spread also within national, regional, and local contexts. We have a digital divide by, for instance, socioeconomic status, by type of health programs organization. We have by age, of course. This is consolidated evidence that we have from empirical data and from the literature. And so the very preliminary, let's say, a key point that I would like to make in this first round of discussion is that if we are to address the digital divide, of course, we should address the political level, and UFA does that through advocacy. So staying closer to the European level institutions and agencies, which is one level, but also trying to understand through research what are the specific determinants of digital health divide. Because as we did, for instance, to make a parallel examples, as we did for vaccine hesitancy, everybody was talking in Europe about the increasing public health concerns of people not willing to get vaccinated. But what we said is that we needed data and evidence to identify setting specific determinants of vaccine hesitance. So I would like to make the same reasoning around the digital divide. I think it's really important, and we are in the position to do that, to identify determinants of the digital divide in order to accumulate consolidated evidence to inform decision makings to address and overcome those barriers. So although some major determinants are well known, I'm referring to, for instance, age or socioeconomic determinants of the digital divide, I think we still need to produce more research to identify setting specific determinants of digital divide, and of course then provide adequate resources to overcome that, but with effective interventions that are designed, planned, and then implemented and monitored and evaluated based on the evidence made available by observational studies and research in general. This would be my, first input to the discussion.
Okay, thank you very much. And also underlining the heterogeneity that is spreading across all levels. And we would, of course, like to hear more about the political discussions behind, and also what your efforts in regard to those political discussions to raise awareness on these issues in the following rounds. And with this, we're coming back to the room again, and we have Mr. Langveld from DG Sante now going to take the floor. And I would like to ask him that we have heard from our experts about the needs and demands from the field regarding the issues that we're addressing today. Does the existing and upcoming EU legislation about digital health that addresses these needs, in your opinion, could you please enlighten us about these issues a bit?
Thank you. Yes, good morning, and thank you for having me. Coming back also to the panel introduction, at least I'm not a lawyer, but indeed I will talk about legislation a bit now. And phrased like that, of course, the official Commission answer is yes, but in a bit more detail and to explain also the context around. Now, one of the things specifically for European Union action in the health sector is that compared to let's say, more classical internal market things, our competences there are a bit more restricted. So we have the famous Article 168 of the treaty. We need to respect member states' competence for definition of the health policy for organization and delivery of health services and medical care, also including funding. So in that sense, our hands are sometimes our mandate is limited by the treaty, especially when it comes to the actual delivery of care part, so the interactions just between patient and their doctors. While, of course, on the other hand, when it comes to things that go via the internal market area, there we have things like just now the pharma package that went out, which will also address accessibility of medicines. In this case, that's really about pills and related things. But coming back with this big caveat at the beginning, coming back to digital health, and specifically because that is also my daily bread and butter, the EHDS proposal, the European Health Data Space, where we have, in a way, 2.5 legs of the proposal, which also address some of these concerns. So the first main leg on primary use, where we want to improve people's access to and control over their own health data by enabling, including for cross-border cases, seamless exchange of information such as e-prescriptions or patient summaries. So what would this mean in practice once adopted and implemented? Very practically for a patient in the digital divide area, one problem people sometimes face is how to get their documentation from healthcare provider A to healthcare provider B. That is something which we intend to address there by making sure that records are kept in interoperable formats, can be exported in interoperable formats to be precise, which means that these things can happen in the back end. So when I go to a new GP or when my GP has referred me to a specialist, this information on my medical backstory can travel in the background, so to say. Now, I don't have to explain that again and again. This can also help with the digital divide aspect, so people would not have to log into the hospital's portal, get the information out there, get it somehow over to their GP. These things should be working in the background. People have mentioned age as one example. So what we do foresee or what we do include in the proposal are rules on what we call proxy services, where a patient could delegate these access rights to somebody else. The obvious case are parents or legal guardians for their children, but you could also have an elderly person delegating that to a family member, somebody giving their spouse additional access, these kind of things. So that we fulfill in there. Also for people for disabilities, we have a specific task for the digital health authorities, which will be framing these services to make sure that also those people can easily access these tools. Now, one very important thing, going back to the initial point on member state competence for the delivery of care, what we're not doing here, because one point that was mentioned earlier as a problem for access of care would be to make things mandatory. That simply we're not touching at all. So we're not saying you have to do it this way. People can still simply go talk to their GP, have the discussion there. But what we're enabling on the primary use leg of EHDS is that the health professionals would have the information of their patients kind of seamlessly available in the background without the patient needing to have digital skills themselves to intervene and take action. That on the primary use side. Very quickly on the secondary use side, so the reuse of data generated, let's say broadly in the health sector for research and also policy development purposes. There, as also was mentioned earlier, one of the problems that were faced in the past was lack of availability of data, and specifically not randomly distributed across the population, but certain marginalized groups were often underrepresented in the data, hence underrepresented in the evidence bases on which planning would be made. Hence, these problems perpetuated themselves. Thereby mandating a really broad availability of data, so making sure that for policy planning purposes, the widest range of data is available. This should address this concern, so kind of on a meta level for future planning. Those are kind of the two main legs of the proposal. I could go on a bit on the predecessors on My Health at You in its current incarnation, but mindful of time, I will stop here, and if people are interested in that, we can also do that later in the session. Thank you.
Yeah, sure. In the following rounds as well, you can contribute that as well. And thank you also for shedding light a bit on European Health Data Space proposal, because indeed that will be one of the major things that we'll be addressing in the upcoming years, and actually even now. And with this, I would like to go for one of our online participants, Dr. Wong. So now that we heard about the developments in the EU legislation, I would like to ask you the leading question in a way, because in your research, you were rather critical about some of these developments, and if I'm not mistaken, of course, specifically you underline that given the diversity and complexity of European healthcare system, ensuring inclusivity is essential for this digital transformation, and present some of your concerns that might prevent from us achieving this goal. So do you think the EU legislation might play a role in this, and how would you suggest EU legislator to proceed in that regard?
Well, thank you for your question, and again for the invitation to speak. It's great to see some familiar faces here, and sorry I couldn't be there with you in person. I'm actually joining you from Geneva, where we have the World Health Assembly this week. So my background is as an epidemiologist and a global health practitioner. So as mentioned, for my intervention, I'll draw on some of my recent research on digital public health in Europe, my current work with WHO and the Lancet Financial Times Commission on Governing Health Futures, which I had the pleasure of joining. So I'll preface my intervention, I think, by saying that I'm cautiously optimistic. I think it's evident, as you heard from the previous speakers, that there's the European healthcare system is super diverse and complex, and these pose challenges to achieving inclusivity when it comes to digitally transforming healthcare systems. And that really necessitates careful consideration of inclusivity in the digital transformation journey. So I think existing and upcoming EU legislation should really be prioritizing inclusivity and addressing specific needs and characteristics of each member state's healthcare systems. So I'll center my intervention around several key areas that I think the EU legislation can focus on, so it doesn't fall short on achieving these objectives. So I think the first is around bridging digital divides. I think as you've heard already, prioritizing inclusivity and considering member state-specific needs is really crucial. And you've heard from the previous speaker about addressing the European health data space. So we highlighted in our recent paper in the BMJ that to bridge digital divides, the European health data space needs to ensure equitable access to healthcare data across member states, and doing this by addressing disparities in digital infrastructure and capabilities. So it can promote data sharing and interoperability, mandating the development of infrastructure in underserved regions, and really incentivizing collaborations to bridge gaps and provide equal access to healthcare data. The second is around considering the implications of digital public health and its potential impact on public health policy and practice. So we've seen that EU legislation can play a really crucial role in enhancing digital public health across member states. It does this by promoting the adoption of digital tools for monitoring public health indicators, as well as by encouraging the use of data analytics and artificial intelligence. So legislation can really support more efficient and targeted interventions. We highlighted in our recent paper in the Lancet Regional Health Europe, which I co-authored with Anna, that EU legislation should really be considering the implications of digital public health and supporting the integration of digital tools and data-driven approaches into public health strategies. And by doing this inclusive approach will really ensure that the potential benefits of digital technologies are realized across different healthcare systems and populations. The third is around, developing and investing in digital capacity and ensuring adequate resources and funding in that space. So I think EU legislation can play a vital role in fostering inclusivity by investing in digital capacity within healthcare systems. By allocating funding and resources, it can support initiatives like implementing electronic health records, telehealth infrastructure, digital communication platforms. And we emphasize this in our paper in PLOS Digital Health, which Anna mentioned Eurostat data. So we had a look at this Eurostat data, and we saw that we really need to prioritize the development of digital capacity. And that involves improving digital infrastructure, providing training and support for healthcare professionals, and promoting digital literacy among patients. And I think through these measures, EU legislation can help to bridge digital divides and ensure that all European citizens can access and benefit from digital health advancements. The fourth is around interoperability and data exchange standards, which I think need to be promoted to enable seamless integration of digital technologies across different health systems. So this links in with the European health data space, and I think by establishing standardized formats and protocols for electronic health records, it can really help to facilitate this integration and enable continuity of care, as well as improve the patient experience. So I think that by emphasizing interoperability, EU legislation can foster this collaboration and facilitate the integration of digital technologies and ultimately enhance patient care and promote inclusivity in the digital health landscape. I'll also refer to a bit of my work that I've done with Transform Health around the data governance principles, which bring a human rights and equity lens to the use of data within and across health systems. And these are oriented towards supporting sustainable and resilient public health that can deliver on UHC, universal health coverage. So we've set these out to create a common vision where all people and communities can share, use, and benefit from health data. And we've clustered these around three interconnected objectives. So first is around protecting people, so that's individuals as groups and communities. Promoting health value through data sharing, interoperability, and innovative use of health data, and by prioritizing equity, by ensuring that equitable distribution of benefits that arise from the use of health data. And these are a really critical step towards the development of a global framework for health data governance that we're pushing for at the next World Health Assembly next year. And we do encourage stakeholders to endorse these principles to really help maximize the public value of health data while protecting individual rights. So the fifth is around collaboration amongst member states, healthcare professionals, tech providers, and other stakeholders. So I think EU legislation plays a really critical role in fostering these collaborative initiatives. By supporting cross-border networks and platforms for sharing best practices and innovative solutions, legislation can promote this collaboration and knowledge sharing. And this inclusive approach can really enable the leveraging of expertise and resources across Europe and ensure that digital transformation can consider the diverse needs and perspectives of its citizens. I'll refer to some of the movement that's happening around this at the global level. I mean, last week, we had a health data collaborative meeting, which brought together a network of over 220 partner organizations in 7 different constituencies with the mission of providing a collaborative platform that aligns technical, financial, and political resources with country-owned strategies for using data to improve health outcomes, with a really specific focus on SDG targets and communities that are left behind. Our meeting at the World Health Assembly reviewed data governance principles, policies, and best practices to promote a comprehensive investment strategy in country health information systems and called for more collaborative initiatives, stakeholder alignment, and interoperable standards. The sixth is around this patient-centered approach, which Nisha touched on. I think this is really essential in legislation when we're digitally transforming healthcare, is ensuring patient involvement. And that can be achieved by mandating patient engagement strategies, involving patient representatives in policy development, and also emphasizing privacy and data protection to ensure patient control over health data and fostering trust in digital healthcare solutions. And my final point is around the intentional and meaningful involvement of young people. So drawing from my work with the Lancet Financial Times Commission, I think one of the things that we did was we took together and gathered perspectives and experiences from children and young people, because nearly 40% of the world's population are younger than 25 and will be by 2030. And as such, we really stand to gain or lose the most from digital transformations, including in health. So we laid out a conceptual framework for digital determinants of health, which are increasingly shaping our health and well-being, both directly and indirectly, positively and negatively as well. And Anna mentioned these determinants of health. But the digital determinants of health that we propose are these conditions in the digital environment that affect a wide range of health, functioning, and quality of life outcomes and risks. And this includes things around access to technological tools, digital literacy, community infrastructure like broadband internet, and it operates at the individual, interpersonal, community, and societal levels. And they're increasingly shaping our health and well-being, as I said, both directly, so by promoting health information or misinformation, use of digital health and well-being tools like wearables, but also indirectly through a wide range of social, economic, commercial, and environmental factors. So because they do this both positively and negatively, policymakers really need to be more concerned about the short and long-term health and societal harms. And finally, we're seeing that both between and within countries, young people's experiences of digital transformations are really diverse, depending on their levels of digital access and socioeconomic backgrounds. As Nisha pointed out, and we've done some work on these digital childhood profiles, some are digitally consumed and vulnerable to online harms, whereas many are digitally excluded, which affects their access to things like education and employment, as well as health information services. So we set out this youth statement alongside the Lancet Commission report, which emphasizes a human rights-based approach, inclusive governance mechanisms, and fostering digital skills, education, and innovation as key elements for future health governance. So just to conclude, I think the EU legislation plays a really vital role in addressing inclusivity in the digital transformation of healthcare systems by implementing specific measures and initiatives. And we need to really prioritize inclusivity, bridge digital divides, consider the implications of digital public health, promote digital capacity development, support interoperability, foster collaboration, and really emphasize patient involvement and the intentional and meaningful engagement of young people. So yeah, I'll end there. Thank you.
Thank you, and I should say that I like the cautiously optimistic approach. It's something that I could subscribe to. And thank you for also clustering the issues that the EU legislation should address very nicely. And actually, while with this, going to the final remarks, because we have more or less like 15 minutes before moving to the Q&A, which our audience is very much waiting for, I hope. I would like to ask Nisha one last question to make your final remarks. That in your research and also in your first remarks, you specifically focused on vulnerable groups. So how can the ongoing digital transformation in healthcare could exacerbate these division for these vulnerable groups, you think?
Well, I think certainly what Brian was saying around doing that meaningful engagement and involvement, I think, is really, really key. And what happens is we haven't up to date really been doing very well in engaging with the vulnerable. So we're talking about people that might, have disabilities, that are, of certain age groups, that might be generally disenfranchised in society, from various socioeconomic groups and etc. So, we're getting better at having conversations about these things, and the fact that we are recognizing that these are real key issues is really significant. And we are getting better at having these conversations, but I think we need to have these, as I was saying earlier, we need to have these discussions at scale, and we need to actually bring those people in. And I know Brian was saying that there are initiatives to, have patients and public, sit on committees and be part of that sort of discussion and decision making. But through our research, we've also identified that there are groups that are never ever engaged with on any sort of key issues, least of all sort of digitization. So we kind of made it a point that actually we're going to go and find some, people in some deprived areas and actually start to engage with them about digital technologies. And what we found was, once you actually start explaining and informing people about how things might work and what the ethical and social impact issues might be, they can actually begin to think about how these things will impact them, actually what they want in the end, what preferences they want. And they want things as I was saying earlier, they want them to sort of align with their own values and they don't want to be left behind. So I think what I would like to see is, when we're evaluating these technologies, to have these sort of real impact assessments. So we need to have these ethical impact assessments, and we need to do them right at the beginning of any sort of development design process of these technologies and do them throughout as well. And that's actually reflected in the conversations that we have with members of the public, is they actually want to have that sort of due process and really balance what the benefits and risks are. And that's how we're sort of, building trust. So those are sort of the key things really that have been coming out from our discussions. We are getting better, but we need to do better.
Okay, great. Thanks for shedding light on those aspects as well, like involvement of these groups in due processes. And actually, right on that point, maybe I can ask Professor Odone at this point, like, what is your involvement, or what could associations like the European Public Health Association could offer in that regard? And do you have any final remarks after hearing our other panelists today?
Yes, thank you very much. I mean, one point that emerged from colleagues that speak before and after me is, what does the EU, and I'm glad DG Sante is represented in the panel, do for digital health? I mean, Brian is optimistic, and I do share her angle and perspective, but if we go back to the treaties, as it was mentioned earlier, I mean, the big statement to say is that the mandate for protecting the legal mandate, and I'm not a lawyer, I'm a physician, specialized in public health, so I'm not, knowledgeable enough, but I feel safe to say that we all know that the legal mandate that the EU has on health is limited. Apart from health emergencies and all the circumstances where we note that the European Union level can act directly. Otherwise, it's just, but it's mainly priority setting, establishing a global plan. And if we refer to protect health, introducing digitalizations, we have nice and promising examples on the role of the EU to protect health through digital solution. And I'm thinking about, as it has been mentioned, the European health data space to allow some sort of normative and technical infrastructure to allow the right to health through data sharing across European member states. But we might reflect on the legal instrument that might make the EU level stronger in terms of digitalization of health in Europe. This is a point that I, from the UFA perspective, felt very strongly to share with the different perspectives represented in the panel, and I believe in the audience of this conference today. With reference to what UFA can does in that direction to allow greater European level action to make great use of the digital solutions that are available in different settings for health. Well, I should say, of course, advocacy and networking, but also being the true umbrella actor that can bring together excellence and best practices and successful experience available in different countries to the wider European Union. So the networking capacity that couples with the advocacy, this is on one point. And on the other level, the research aspects that I do not think has to be left aside, because I'm a researcher myself. I'm working in the academic environment, so I truly share the importance of supporting with the evidence policy actions. And in the field of digitalization, I think we should be very aware of other interests that drive digitalizations in Europe and make sure that the research is done without or non-declared conflicts of interest, because, I mean, we know that there are many, let's say, economic interests in bringing forward digitalization in Europe, and I think a role that the European level should have is trying to be, the best gatekeeper to monitor those interests that are not related to protect population health. And the third component is bringing public health researchers, which I would like to stress, public health is not, at least at the European level, a medically driven discipline. It is the case, unfortunately, in Italy, where public health is mainly done by physicians, but luckily enough at the European level we have now understood that public health is a multidisciplinary disciplines that brings together physicians and the healthcare sector, but also social scientists, economists, architects, IT people. So this is another thing that UFA can do, brings together people with different expertise and different competence to drive forward European digitalization with specific reference to get equal access to digital solutions. So if I should say, with one more pessimistic approach and one more optimistic approach on the potential role of UFA and European public health people, these two might be my closing remarks to the discussion that we're having this morning.
Yeah, thank you very much, and we will be following your efforts as UFA very closely in that regard. And Mr. Langfeld, we heard from our panelists what do they want and how do they optimistically criticize the legislation. So could you maybe please answer those points or give any final remarks that you might have?
Yes, I can elaborate on some of the things a bit before. Indeed, before I was mostly talking about actual legislation. Part of what Brian talked about was show us the money, or the need for investment. So that is kind of slightly different. And indeed, we do have, for example, initiatives on training of medical workforces under the EU for Health program. More in general, so going way beyond EHDS. And member states have also earmarked quite a bit of money under the Recovery and Resilience Facility for digitalization of healthcare systems. So that's 12 billion euros. So there are things happening there on collaboration and networks. One of the things, and I'm circling back to EHDS a bit, indeed we do have certain European infrastructures that would support these exchanges, and networks between the called national nodes where they cooperate, share best practices, and so on, including also in the EHDS board, where, moving over now to citizen engagement, we do have provisions on involvement of patient representatives groups and citizen engagement now, and really in the wider sense, kind of as a part of our preparation of this proposal, we of course had the usual rounds of consultations, where including OIFA, for example, did submit their positions. Now, of course, these rather structured consultations, well, you rather have organized group answering. So you do have also European patient forums, but you would indeed less have the disenfranchised youth who is facing issues in accessing healthcare. So in that sense, well, we do take those views into account, but in a way we also face the same difficulties in getting views in as people do on the national level when planning digitalization in the health system. I think, yes, that would be it for me. So indeed, we do provide quite a bit of money to member states for them to co-finance then projects in this area, but that indeed goes a bit beyond legislation, strictly speaking. Thank you.
Thank you. And before moving to the Q&A part, I would like to give the floor to Dr. Wong for his final remarks here at this point then.
Yeah, sure. Thanks to everyone for raising some really important points. I think maybe because I'm here with WHO as well. I think on the role of WHO, I think we've got a lot of convening power to have the stakeholder alignment and kind of cross-disciplinary collaboration. As Anna mentioned, public health is super multidisciplinary. I think it's up to the member states to set those agendas, such as health data governance, like we're calling for next year. That political commitment is super key, but also having active civil society to advocate for what they want to be invested in and to hold member states accountable for what they do commit to. And then thirdly, I think is around this notion of public-private partnerships, because we talk about innovation, and I think we heard earlier on in the meeting that the reason why a lot of private sector solutions don't work is because the public sector doesn't often tell the private sector what they want or include them in a lot of these processes. And last night, speaking of whole of government approaches, we just had the launch of the WHO Council on the Economics of Health for All final report, which calls for reorientation of economies to deliver on what really matters, and that's health for all. And to quote Mariana Mazzucato, it's having this mission-oriented approach that starts from this health for all goal, and then redesigning economies backwards to deliver on this goal. So we can't accept health as being this aftermath. We need health to be at the forefront, and then not weaken our public sector by creating all these parallel systems and weakening trust in institutions. So I think we need to really reimagine how we're seeing this and approaching this through seeing health financing and health and well-being as an investment over a short-term cost. Thanks.
Okay, thank you very much. And we still have around 15 minutes for this is more of a statement than a question part from you, and it will give us some time. And please refer to whom you actually address those questions as well. And with that, we can put the floor. I think you will receive the microphone, right? So that our online panelists could also hear if the question is addressed to them.
Thank you. Andrew Adams, Meiji University in Tokyo. Thank you very much all for a very interesting initial panel. I want to raise something which hasn't really been brought out separately yet, which is mental health is often the poor sister in health systems. And it's also an area where there is even worse inequality in general in provision and in capability. I wonder if you have any comments about the specific challenges of mental health issues in these sorts of digitalisation area. For example, mental health problems have much higher privacy concerns often amongst patients than some sections of physical health problems. So I wonder if you have any comments about how mental health and digital provision come together.
Yes, indeed, that's a very important question, and I think that actually all of our panelists would like to contribute to that, or do you have anyone specifically on mind? Okay, so anyone who would like to answer this question?
I could just sort of maybe touch on it. So certainly we need to have parity of steam when it comes to looking at general physical health and mental health issues. Yes, absolutely. I think certainly there are issues around people not being able to, for instance, protect themselves online, and I think that's a general issue. But certainly people that either lack those digital skills or have certain mental health difficulties might struggle a bit more on those things. So I think from our perspective is actually we haven't looked at mental health specifically, but I think that you're right, that is actually something we need to be doing. We need to be sort of looking at this on the same level as physical health because, as you say, they are more likely to be the most vulnerable sort of groups in society. So I just wanted to touch on that.
Yeah. Maybe Brian would like to also intervene here as well, because I know that you also specifically work on vulnerable groups such as youth, and maybe could also touch upon this aspect as well.
Yeah, absolutely. It's actually a fantastic question. Thank you for asking it. I mean, I'm Canadian, so we actually just had a Canadian youth roundtable with our Minister of Health, Minister of Mental Health and Addictions, and our Chief Public Health Officer which was talking about how we build young people's resilience in a lot of these post-pandemic discussions, and specifically around mental health. So I think, as has been mentioned, there's no health without mental health. We saw that particularly, young people and vulnerable groups had disproportionate impacts during the pandemic. So I think, as we're now in this process of discussing, pandemic preparedness strategies and how we strengthen health systems to make them more resilient and offer mental health services, we definitely need to be discussing these. And digital can definitely be leveraged to provide a lot of mental health support for young people. And I think we also saw how young people have leveraged digital to foster online communities, to provide peer-to-peer support and things like that. But I think a lot of our discussions that we had were around promoting health literacy, mental health literacy, especially fostering adaptive coping mechanisms, and then also providing mental first aid training. So I'll leave it at that. Thanks.
Yes, in addition to that, also at Tilt, we have some research conducted on mental health and especially in online suicide prevention as well. So anyone who's interested, you can also read our work as well there. So is there any other questions on the floor? Do I see? Yes, sure, please.
Hi, I have a question about the push for digitalization in regards to how expansive we think it will be. For example, if someone has arthritis or trouble seeing, should the technology be made to suit them, or should they get a piece of paper with large text? Or in terms of patients with dementia and the proxies that you were talking about in the DG Santé, what are the mixes? Is it of ways to have digital or proxies or non-digital systems in the future? Because not everything might be able to be digitalized in an optimal way.
Do you have any numbers or
On costs? Got background. On costs, I don't want to dig up numbers now from the impact assessment, but we have looked into some of the costs specifically on EHDS. What you're asking is broader, and indeed not everything can be digitalized, and there is, of course, large parts of healthcare will remain in person. There's and no, those parts, of course, need to continue. So digitalization is always kind of in a supporting role, in our view. Also, to quickly come back to the previous question on specific mental health, and then the link to privacy concerns that are even stronger there than for physical health. What we do have in the proposal is also a possibility for patients to restrict access to their data. And indeed, mental health is one of the classic things that my GP does not need to know about treatment for depression 10 years ago. So that quickly on those 2 points.
Yeah, sure. And indeed, that's one of the actually aspects that deepen the problem that we discussed today. And Nisha, for instance, mentioned, and Brian also mentioned, that accessibility and a cause that mostly interconnected with each other. So I see some other hands for questions. They're still here, or yes.
Hi, Colette Kuipers from Tilt. I hear a lot about digital literacy and about involving more the younger people, and this is something that I do not only hear here in relation to healthcare, but for example yesterday in AI it was also all about literacy. But when I then look at my case studies at home, my 2 teenagers, I find the education in our schools lacking at every level on digitalization in society. Youth uses all kinds of technologies, but is hardly aware of these implications that we are discussing here. And I was wondering, and maybe it's not the right question to pose here, but maybe you do have some thoughts. Is there any mechanism that we can use from more of an EU level to at least do something about this lack of schooling that we have at least that I experience, at a rather broad level, both in elementary schools, high schools, and maybe even further. My experience is that only at the level of university we're starting to discuss these things, and I think this might be way too late, and I think that also relates to what Dr. Wong was saying. So do we have any mechanisms in the European Union to make sure that we do something about this lack of digital literacy in our youth?
Yeah, sure. And I think that needs kind of like roundtable answers. So I would like to give the floor to each and every of our panelists. And maybe I could start again with Dr. Wong, because I know that it specifically works on like, related topics that are related to like youth and their perspective. And you can also maybe provide us with some comparative examples, given your involvement with the policies on global level.
Sure. I mean, I think that's a really important question, and absolutely we're realizing that we're not seeing enough of this movement from the beginning, from where children are starting to learn, and a lot of it, I think, is a matter of going to where they are. I mean, if you look at where a lot of young people are accessing information these days, it's not from a newspaper or television, right? It's from social media. It's a lot of children are accessing information on platforms like Snapchat or TikTok. Something that is around that we really need to highlight is around making sure that the information that's then on these platforms is safe, it's trusted, and WHO is doing a lot on this space when it comes to the infodemic management, where we saw at the height of the pandemic. And that then also has links to mental health and anxiety, right? I think at the EU level, I think there's initiatives that can be leveraged, like Digital Skills and Jobs Coalition, which we can bring back to the future of work and to education. And I think addressing things like in Digital Education Action Plan and things around children's rights and safety in online spaces will really help to equip both students and teachers with necessary skills as they're growing up in this digital era. Thanks.
Yeah, thank you. Maybe Professor O'Donnell, would you like to add some remarks on it?
Yes, I mean I do think it's a critical point. The issue around how to train young generations on digital literacy, also taking into account the great risks that children are exposed to in a digitalized world. And as a mother, I mean, I do share concerns around the risks. I'm not sure whether, I mean, for sure the educational setting could be the place where to promote proper use of digital technologies, which involves, I mean, many aspects not necessarily related to digital health literacy. So I do agree on that. But on the other side, I think is we should put the accent on who is responsible for exposing young generations to digital risks. And I'm aware of a lot of organizations and civil society, NGOs that do work on those aspects through advocacy on digital rights of young generations. So this is a very critical point. And if I may, a point on mental health that was raised earlier. I mean, we have 2 minutes left in the discussion, so I don't think there is enough time to elaborate. Let me just recall that telepsychiatry, I mean, one of the most advanced digital health solutions in the clinical settings are those provided within mental health. This is not population health, this is not public health, this is clinical telehealth services, but it's true that the most advances in digital health in the clinical setting are those in psychiatry and mental health. So this is something we should take into consideration. And with reference to costs, I mean, one thing is establishing costs, and the other thing is how digital health tools are integrated and reimbursed in different national health services, which is an ongoing discussion in member states.
Yeah, thanks. Nisha.
Yes, absolutely. Totally agree with that. I think just sort of on the question of sort of how we, bring these conversations to the younger generation. So in our research, I think probably the youngest individuals we've had are probably around 19, 20, probably nobody younger than that. And what we've found through our conversations with that age group is, yes, there's generally the attitude that, oh, we use technologies all the time, and they don't really think about the privacy issues or, the ethical issues that come with all of that. So last year, we actually did an engagement exercise. We created some really basic games to sort of present to young people. So we had people, young children to sort of teenagers coming and sort of discussing with us how AI technologies are being used in healthcare. And it was interesting, sort of the various perspectives that we got, and they found these things very fun and interesting, but it started them thinking about, what are we doing with the data? Where is the data going? So I think we need to probably create some really simple solutions to start these conversations and embed them into the curriculum, to the educational curriculum, especially when children are learning how to code, for instance, or learn about IT. Those are probably the spaces in which we can have these conversations and educate young people.
Thank you. Final remarks.
Very quickly, and then maybe connecting to the rest of the conference. Indeed, yes, there's a distinction between using technology and being aware of its implication. And yes, education has an important role in that. But to put it back to more pedestrian example, yes, schools also sometimes teach children how to behave in traffic. But the big part to make sure that kids are not getting run over by cars are codes of the road, safety for cars, etc., police, and so on. Meaning there's a role for people to protect themselves, but also there's a role for legislation, be it GDPR, be it DSA, be it DMA, and there's dozens of panels at the rest of this conference about this. So that really goes way beyond the specific digital health part.
Yes, with this, I think we can conclude the panel, and I would like to thank on behalf of Colette as well to both our panelists and our participants. And we could, I think, move to lunch area now, because we have already started losing a lot of people to lunch already. So thank you very much for joining and being part of this debate. And thank you to Brian and Professor O'Donnell as well for being part of this panel today. Thank you.
Thank you.
Thanks.